Am I audible?
Yes, you're audible.
Yes, okay, sir. Okay, sir. Good afternoon to all. Myself Nikhil Ingavle, and I have the privilege of serving as your facilitator for this session. It is my distinct pleasure to welcome you all to this session today. Today, I am going to introduce the remarkable individual who will be sharing their knowledge and insight with us today on work-life balance. First, let me introduce Dr. Bahubali sir, who will be the speaker for today's session. I would like to mention a brief introduction about Sir. Sir has completed MSc. Sir completed PhD from Bharati Vidyapeeth deemed to be University, Pune. Sir, having teaching experience, worked as associate professor in various reputed college. Sir is presently working as an associate professor in Bharati Vidyapeeth College of Nursing, Sangli. Sir has guided many UG and PG students for research. Sir has appointed as an external examiner in various reputed institutes. Sir has published research articles, papers in various national and international journals. Sir as a resource person in national level conference. Also, Sir has attended many workshop, seminar, conferences as participant and organizer. Sir is a member of professional organization TNAI, Indian Society Psychiatric Nursing, ISPN, NRSI. So I would like to welcome Sir for today's session. Bhabuli sir,
Yes, sir.
over to you, sir. Thank you.
Yes.
Yes.
Thank you for the brief introduction of mine to the audience. And yes, my screen is visible there?
Yes, sir.
Okay. Yeah. So first of all, I would like to thank Eco India for collaborating us with this program. That is the targeted group is staff nurses, which are like the theme upon the theme that is mental health priority for staff nurses. And actually, it's my privilege to talk to the nurses, but unfortunately, due to some busy schedule and things like festive season, I could see that there are hardly around 20 nurses who have been taking part for today's session. But nevertheless, let it be a small group, but be the beneficiaries. One, to spread the discussion which we are going to have today. So basically, the theme of this program is mental health priority for staff nurses, which was envisaged, and like the today's third session, which will be dealt upon work-life balance by myself, and I take this opportunity to move forward. So if I have to move forward, we'll have to just look back what happened in the last Friday session, which the takeaways from last session, which were dealt about well-being, mental well-being, and nurses' mental well-being. So we are challenged at many times, and actually the nurses prioritize their well-being is utmost important because the emotional and physical balance can be managed by the nurse, and the effective care or quality care can be provided. So nurses well-being is a crucial to provide quality of care, in conclusion to say. And nursing wellness or nursing well-being, which may constitute about nursing wellness and nursing self-care. So nursing wellness involves physical, mental, and emotional balance or maintenance of appropriate health in these areas of physical, mental, and emotional. So, the demand of the job as the nurse carries out in the hospital, it may expose to the psychological trauma, burden, and many more consequences, which can be ranging from just a psychological disturbance to even sometime towards a mental illness as well. So it is essential to prioritize self-care and wellness to prevent burnout and maintain job satisfaction. Because if we look about our individual life, why we are working, why we we are doing such a hard work and we are caring for the patient, as the sole purpose is like to have a satisfaction in my life by achieving satisfaction of service which is provided by me, as well as by earning some amount of money which will be sufficient for my livelihood, and I could do something better for my hierarchy of the preceding family members like children. So this is how we are supposed, we are all conceptualized to engage into some or other professional work and serve the community in whichever possible way. But while doing so, there are many responsibilities, many work related stress, stressful events, or the magnitude of service which we have to do, or multitasking, which at a time, sometime, it will be exposed. So all this makes us to understand about the balance, maintaining the balance between external harmony, which we are behaving, and the internal harmony, which we are supposed to have with us as a composed mindset or composed approach towards the task which we are doing in our professional life. So there is a balance. Okay, balance is a very important aspect of anybody's life, everybody's life. But in particularly, if I have to talk about nurses, it's utmost important, which we are going to highlight in the coming slides. But to remind you, all the fellow nurses who are there with me now, if you see many social media influencers, or the corporate counselors, which are corporate companies, which are all are focusing much upon employees' balance of work and their life. So it is very much a buzzing word nowadays to have work-life balance. It's very much challenging, and as we are going to see further why and what are the reasons for highlighting this work-life balance, which is particularly for nurses, which we are going to discuss. But before beginning with the work-life balance discussion, I would like to highlight two of the quotes which are very relevant in order to understand work-life balance. That is, you will never feel truly satisfied by work until you are satisfied by life. So, first of all, we have to be satisfied with ourselves and our life, or whatever we have in our arena. With that, if we are satisfied, then we can do well, and we can be satisfied with the work also. So this quote was given by Hitesh Shah, who is a founder of Glama Kama, which is clothing brand of USA. So, and then the other quote which goes like, "You can't work in a paint shop without getting paint on yourself." The question is, how much paint will that be? So it's a matter, if you can understand. We can't paint a wall with a brush without getting some amount of paint on our hands. But how much is that paint? That matters, in the sense, when we are working with the patients continuously, we are seeing several situations, we are encountering some emergency areas, critical areas, and there are many lot of hazards which are associated with the service which we provide. And while doing so, we may see many adverse outcomes in the events of nursing care in the hospital. That is, sometimes the patients may die, or some mass casualties may arrive. So all that puts us in mental stress, burden, and the workload or work pressure increases, and the prompt service, providing a prompt service becomes a real challenge for the nurse in such situation. So now, how to handle it, how to manage it, how to see that the appropriate service is provided, as well as end of the day, how satisfied a nurse is. So that matters a lot while doing, or while serving with the patients or clients in the hospital. So my entire today's brief overview or discussion, which will be based upon the work-life balance, with the objectives of to understand what is work-life balance, and to realize reasons for imbalance, and to recognize the consequences when the imbalance occurs, what are the manifestations, and what can be the way ahead or tips to prioritize and understand or preserve the nurses work-life balance. So basically, if we understand a work and a life which has to be balanced, which has to be managed in a way that as we look out at the life, the similar thing should be with the work also. Okay, if they are influencing each other, our life is satisfied, our work also will be satisfactory. When our work is satisfactory, vice versa, it may be witnessed. So any one which is imbalanced, it is influencing on each other, and there is a total collapse of psyche, of the psychological equilibrium which is made up of, that can get destroyed, and the person may be vulnerable for many other personal casualties or psychological traumatic situations or the stressful situations, in simple words. So what is work life balance? It is a state. Okay, it is never at the one point. It may oscillate between high to low, or it is bound, like, no employee of no professional work, whatever the position he is or she is holding, but still at any point of their time of professional life or professional service, they are bound to have this disequilibrium or the disturbance in the equilibrium. Hence, it is called as a state. State means here and now. I am today fine, but tomorrow I may have some other life challenges or adventures which may influence upon my incapability of proper work. Or sometime work, something happens in the workplace that may influence upon life. But work-life balance tells us that how well we are equalizing or balancing those work and life tasks. Okay, and we are carrying forward or moving forward by facing the minimal challenges and overcoming the whatever possible ways. That is a state of equilibrium in which the demands of both person's job, professional life, as well as personal life are balanced or equal. So that is how the meaning of or definition of work-life balance can be quoted. So in other words, work-life balance is the state of control, achievement, satisfaction in your life. It means that you have a sense of being able to make choices that is fit for you and given your current situation and your goals. So based upon your current situation and your current goal or the ambition which you want to achieve something, based on that situation, what choices you are making, those choices are fit for that situation and to reach such goals which you are setting. So when you are able to make such sense of being ability to choose the correct way or the path which is fit for you to overcome the situation by understanding or by considering the current situation, that can be described as work life balance. So, dear participants, are you getting me what I said, like as a work-life balance? You can put a message in the chat box, or even you can unmute and say the feedback. Do you understand what is work-life balance now? Yes, you can drop a message in the chat box also. Okay, so hence we realize that like life, family, work, okay, then career balancing is utmost important. So integration of your self-wellness and self-care into your work is very much essential, and the individual has to manage the family, career, work, and life as overall. So it becomes, life is a heart or work is a brain, like, but both heart and brain work together, then the body functions properly. In the same notion, the work life can also be described. So what are the reasons for imbalance? Why there is a work-life imbalance which may occur at a time in general professional, all the professionals as well as specific to the nursing professionals. So, why that imbalance has occurred, because I hope you all will agree to my opinion, which I am going to put forward. That is, uh, the stress or the magnitude or amount of stress which is today has enormously increased, which was there 15-20 years back. Do you agree with that? Because the corporate world is expecting many things, lot of things to be done as a progress or as a economical growth. which is causing high expectation, high workload, and ability to serve at the optimal level. Beyond the optimal level, the expectancy has been put forward. So globalization, okay, then economic boom, and the reason for imbalance of work life is even Superman is sleeping here because he's tired with working a lot and overload of work. He's tired. So such Superman also can become tired and get disturbed with psychological functioning. So yeah, this can be one of the where high load, high work environment pressure. Okay, and then the like the competition between the colleagues and individuals, which may at a time put forth the individual to suffer. Yes. Hello, Monita madam. Is there anything?
Yes.
Ma'am, did you say something?
Yes, sir. Sir.
Shall I carry on?
Yes, sir. Sure.
Yes, okay. Okay, ma'am. So there are several reasons which everyone wants to be at top. Okay, nobody wants to support anyone, like just pulling the leg of the one who is progressing well. So all these kind of chaos and the situations at workplace and the global updates, which are making the individual to very vulnerable for having disturbance either in the work atmosphere or in the personal life. So in turn, that may influence upon each other, and there will be consequences which can be noted. So in particularly, if I have to talk about the nurses, what we as a nurse face the challenges, and that makes us vulnerable for, or that makes us important population which needs to practice work-life balance. Those challenges or those encounters which are put forth in front of a nurse, which makes at a time it's a challenging task for a nurse. How long the individual can tolerate these all mentioned upper mentioned descriptions, that is long working hours, high stress at the workplace, shift work, okay, frequent shifting in the I mean the work nature of the duration of work is high, and like shift of the work which may change from morning evening to the night. So work at the weekends as whole family is at home, but the staff nurse is at the hospital serving with the patients. That keeps away from the family life. So in turn, that may be one of the root cause for having a work-life balance, imbalance at the family level or personal life. Then holiday working during the holidays. Okay, and then there are certain additional responsibilities can be placed upon the nurses, which is like overtime or extra shifts to be to meet the increasing staffing needs of the hospitalization hospital. Then while it can be tempting to take more work for financial reasons, I have seen here as a security guards who are securing our campus. Sometime they are seen every time in the morning, afternoon, evening. Sometime when we are visiting for some other reason to the hospital at the night, they are at the duty. So when we ask them, they are saying, "I'm working all three shifts. I'm not at all going back home." So this is very much dangerous. Okay, the shift of work or the managing the work shifts is very much very much risky for a nurse. Then these all things can lead to fatigue, stress, burnout. Burnout is nothing but it's like for any simple reason also, the person gets out as a outburst of anger and yelling at the colleagues or the seniors. So they talk in an aggressive way, and there will be some hazards associated with this burnout for the nurse, because ultimately continuously serving, working along with the clients one after another, that puts a nurse at a place where the nurse may get exhausted, and the maladaptive defense mechanisms such as like aggressive nature of a person can come out, and there will be a lot of hassle or the complications which may emerge out of this burnout, and we may see some ugly fights also as well. Then ultimately impacting the quality of care and nursing practice excellence goes down and down with these all reasons of the challenges which are put forth for a nurse. And the problems and challenges faced by nurses in hospital are to extent the problems like shortage of staff nurses. Every hospital, every healthcare organization, if we see, there are a number of shortages of staff nurses. Either there are manpower, less lack of manpower, or the manpower which is existing but not efficient to handle the duties or to manage the emergency situation or critical situation at various settings of the hospital. And that leads to the working increase in the extreme amount of working hours. There is no adequate rest. There is no adequate leaves which are offered as a result of shortage of staff and high workload. Then assigning duties becomes a real trouble for the supervisors and the heads of the nursing department of the hospital. Then comparatively, the salary which is paid to the staff nurses, which influences the nurses' balance in the work and life, as low salary, that is having a high chances of less satisfaction. So less the satisfaction, again, it's a like there will be some or other imbalances which can be witnessed in a passive work or passive family member. Like that, the passivity may influence and that may complicate, and that may lead to the various hazards of imbalance. Then nurses are at the victims of every problem in the hospital. Okay, that becomes one of the factor of the problem or the challenge, which makes the nurse to be vulnerable for imbalance in the work life. And then food and accommodation, disrespect for nurses, and look for abroad opportunity. Okay, and then disrespect for the society or having ambition of going for the higher studies. Okay, or career enhancement. Those all becomes a real challenge for a staff nurse to face them and to manage them and to overcome them and lead a happy life. So at a time, the nurse is exposed to such potential signs, I mean, the challenges which the nurse encounters. So, what are the potential signs and symptoms of burnout? As I told you just now, there will be behavioral professional changes, behavioral or professional changes can be seen. Then, like tiredness or absenteeism also can be very high when there are burnout among the staff nurses. This, as the supervisors or the leaders of the nursing, will have to take note of this. Key why there is a lot of turnover or a lot of absenteeism of nurses in the hospital setup. That may be due to if we introspect or if we do a similar or simple survey, we may put, I mean, we may reach to the conclusion that the absenteeism is due to the burnout, where the nurses are exposed to the high amount of pressure of work, okay, or the shortage of staff nurses or fellow colleagues. That may put up or add upon the burnout, and the nurses may choose to remain absent every now and then, and being critical of others, like there is lack of maturity, lack of understanding or broadness of mindset, which may put forth the nurse to become a critical of others and judge every time what others are performing their action. So that becomes a real challenge for relationship to be carried forward in a positive way, and that broke like break, or there is the crack in the relationship may put forward with the problems. Then consequences of burnout, as like for you, that is excessive stress. Okay, then fatigue, insomnia, depression, negative spill over into personal relationship, as I told you, and then anxiety may also be seen in the nurse, which is pathological anxiety sometimes, and then alcohol or substance abuse is most common. If in such burnout the nurse is encountered for a chronic period of time, then some or other at the long run, heart disease, high cholesterol level, type 2 diabetes, stroke, obesity, okay, and the vulnerability to other infections and illnesses. These are all consequences of burnout. We can't take it so lightly. As a nurse, if you are at a verge of burnout, take precaution and take the suggestions which I am going to discuss in front of you in coming slides. So there are some potential signs and symptoms which are attached with the emotional or psychological changes. That is apathy. Apathy is nothing but as nurse, quality of a nurse, which we define is very caring, very like genuinely interested in the patient care. That signifies some emotional outpouring of the care which is rendered to the patient. But apathy is nothing but cold-hearted, without any mercy. They may talk anything, do anything, talk in any manner to the patient or the colleagues, like that. The apathy is cold-heartedness and less of emotional representation in the interaction. So then hopelessness also may emerge, frustration, concentration difficulties which can be seen, and many errors can happen in the area where the nurse is working or in the family member. There will be concentration difficulties, then anxiety. Alienation is nothing but detaching oneself from the reality of the environment. Depression, isolation, irritability, then doubting one's value or beliefs, which are, I'm believing this one thing which is right or wrong. So the nurse starts doubting on her own beliefs. Then physical changes, which can be seen as a result of anxiety or the depression or frustration, which may lead us as a rapid pulse, fatigue, weakness, dizziness, weight change, insomnia, memory problems, then the lack of immunity, then gastrointestinal complaints. But if we see simple burnout, or I mean the psychological part, that is burnout in the mindset of a nurse, how it is connected with all these psychosocial aspects. Like there is a mind and body connection. Okay, the mind directs the body function, and the body functioning, if it is disturbed, then it may put a pressure upon the mind to function a little harder way, so that the body compensates with a lack of functioning. So like that way, they both are interconnected with the help of blood, with the help of hormones, with the help of neurotransmitters, or in general, I can say biochemicals of the body fluids, which can be connected with the brain and body, and nervous system, which is connected all over the body. So all that is connected, like, mind and body are connected to each other. Anyone is affected, it puts a challenge, or some or other disturbances can be seen in other area. So like that, the mind and body connection puts forth burnout, a psychological phenomena, that is a burnout at the workplace, that may expose the staff nurse to develop some bodily symptoms as well. So this picture illustrates how the brain and the nervous system, which is associated with all the vital organs, as well as the functioning of those organs, and how they are regulated through parasympathetic and sympathetic functioning of a nervous system. Now, coming to the strategies for achieving nurse work-life balance, which is put forth in the pictorial form as well. That is, the one has to set a realistic goals while working. When you reach to the workplace, plan your work, what you're going to do today, what is your goal, and keep some time for emergency work also, so that the goal should be set in a smarter way. That is SMART, smart, which should be specific enough, which should be measurable, which can be measured, which can be quantifiable, and then it can be achievable, which can be reached within the given time frame. Otherwise, if you set a high goal for a small period of amount of time, if it is not achievable, that may change into failure, or that failure may put frustration upon the staff nurse. So the nurse has to plan or set the goal for a day, which is specific enough, which is measurable, which is achievable, which is relevant, and it is timely also. Timely, it means that the need of the hour, or at this time, what I should, or what the goal should I set, that by seeing the situation, the goal has to be set. So this smart way can help the nurse to set a realistic goal. Realistic, not only goals, but a realistic goal. Realistic is nothing but it should be smart. Smart in the sense specific, measurable, achievable, relevant, and timely. Then the person has to manage the time Okay, time management, the tasks has to be managed, to-do list has to be prepared, or creating a schedule of the day, or keeping some reservation of time for certain work that will make a nurse to balance the work and the life very well, so that the execution of work also happens in time. So that can be done by creating a schedule to better manage the time, okay, and can help balance work or personal responsibilities as well. So that, see, when we are not scheduled properly, when we are not planning our work properly, we may mess up everything and we may get confused. So to avoid such a thing, the nurse has to schedule the activity in such a manner where in which the each activity is carried and focused, while carrying the activity only is focused, but not interference of other activities or other responsibilities which should not interfere. So that solution is that key. We have to schedule our activities. Then stay organized. With the task list or phone apps which are available for a note or to-do list. Okay, so you can assemble everything needing to be done in one place. What I am supposed to do it here, so that there is no confusion. Just you can open up your cell phone and you can see what are your goals or the activities which you are set into. Like, so be organized. Don't mess up everything while doing anything. Okay, you're doing medication administration, and the doctor calls and you leave that medication tray there and you go to attend the doctor. Don't do that. You must be organized. When you're doing some work, specific work, you must focus and complete that. Otherwise, then medication error may occur, and there will be some adverse effect with the patient if you are not given medication, or if you give a double medication. So that all simply we are putting ourselves at that problematic situation, chaotic situation. So to avoid such thing, if we are organized properly, the supervisor, ward supervisor, if they assign a work in a proper way, if they manage the staff nurses in a well manner and organizing the work to them, they become more efficient and the quality care can be provided, as well as in turn the balance also can be achieved in the workplace, as well as the personal life also will not be disturbed, as the work life is very smoothly working or satisfactory work which is happening. Then seeking support. Okay, then practice stress management. These are all very fundamental things which we need to do as a everyday life, but these have a very important significant role in our nursing profession as well. Like, if we do these things, or if we are setting a realistic goal, if we are creating a schedule, if we are organized in our approach of activity, if we are seeking the support and help from others or other colleagues or health professionals, and if we are practicing certain stress management techniques as a preventive management, like yoga, meditation, deep breathing, even it can help, or in between the work, whenever you have completed some small goal, you can take a break and you can sit and you can just relax with the deep breathing, or even there are techniques called as progressive muscle relaxation. Okay, so these muscle relaxations can also be practiced, so that it keeps you away from the stress and it keeps you a happier and healthier mind, so that you will be serving in a better way. Okay, so there are some other suggestions which are ways to self-care and work-life balance are: we must set clear boundaries. We should not say everybody everything yes, and we should not be submissive to do anything and everything. We have to set a clear boundaries, what I am supposed to do and what I am not supposed to do. So that setting a boundary which would help a nurse, as a staff nurse, to avoid such unnecessary or what we complain of non-nursing work. A lot of non-nursing works have been done by the staff nurses, so that we have to set a boundary from the beginning, so that that keeps the focused care, or the nursing actions are more than the non-nursing actions which are been doing in the hospital. Then prioritize the self-care, give self-care importance, give priority for yourself first, to take care of you. When you are at a risk, don't indulge into anything. Okay, so that prioritizing the self-care is very important to manage the work-life balance by maintaining a self-care. Then utilize your day off. Okay, don't think or don't worry much about the work life when you are at a day off. spend your day off like you're a family man and you're not belonging to any other profession like that, or you're not a professional worker. You just be a family man when you're having day off. But some kind of emergency, some extra work which may arise and you're asked to reply something or give feedback of something, then these are all optional ones. But don't you yourself indulge into the work life activities when you are having a day off. Keep your day off very simple, focused with the family alone. Then delegate and collaborate with your colleagues. Okay, don't do everything by yourself. Don't overburden your work. Don't take more and more responsibilities which are beyond your tolerance or beyond your execution. Try to delegate that. Try to give it to the co-workers or decentralize the work and let them do and let them carry out and let them come out with outcomes to you. So like that, the delegation which would help. And then very important is learn to say no. This topic itself is a very vast one. How to say no, or what to say no. And if I say no, will I be a scapegoat of something? So that all challenges have to like we have to overcome by a lot of efficiency in our work, focus in our work, and our understanding and knowledge as well. So when nurse is knowledgeable and very confident in her or his execution of work, they have straightforward answer for anything which is beyond their capacity or capability. I can't do it, sorry. And that to be handled in a very professional way, okay, which cannot be expressed in a negative way or aggressive way, which should be handled or dealt in a very polite way, saying no. Okay, then use technology wisely. You can't work out everything. We have to utilize the technology whenever necessary in order to simplify our work, because that is the one tool which is available with us to restore that ability to. I mean, we should manage that. Taking breaks in between the work time. Okay, for these simple tips, what I could suggest uh, every 1 hour you spend in the hospital or work, take one glass of water every 1 hour. So that makes you to fill your bladder so quickly and you need to empty it. So at a time, you'll be forced to go to the urination. So while that break, that itself can be a break, so that what you can do is nobody restricting you as a supervisor or the floor in charges or ward in charges. They're not restricting you to drink water, right? So obviously you can have a glass of water every 1 hour. And then if we are working 6 hours, 6 glasses of water you will be consuming. So that itself gives you some time out from your work, and you'll be spending some time to walk towards the latrines, all that way. Okay, that can become a break. So relaxation time can be spent. Then humor is very important, all this situation. To just quote my example, which morning happened as a humor in workplace. I was preparing with the slides, and I think you all might have noticed the elephant which is standing on a football, so on one leg. So that the guy who is a colleague of mine, who is very happy like elephant, he himself cracked a joke upon himself by saying that instead of that elephant, you could have kept me there. Even I could have been fit into that picture like that. So it is a humor, but it makes a relaxation. It gives us anxiety or the worriness which we had something at that time. It just soothes that and it helps out to come out of it. But remember that you should not be gossiping of third person. It should not be a gossip of third person. You can just make a fun of your current situation, which you are there in that situation. But a humor of, I mean, the fun of somebody else who is not there around you, it is a bad thing which may impact negatively upon the work-life balance. So always try to hunt for your happiness. Okay, because the positive psychology tells that research done in under the positive psychology, happy people are productive people. More optimal brain functions when happy than when negative, neutral than when stressed. Okay, when we are more happy, our brain functions optimally, and it helps us to focus on the strengths, set clear goals, and understand your values and ambitions. The other way, as if there are any higher level or higher cadre of nursing personnel who are joined here, workplace also can contribute for the welfare of work-life balance of their staff nurses. That is, giving flexible schedules, giving some time as a paid time off, then as a leaves, or giving 1 hour concession, or like that. Or professional personal development opportunities are given, then social connection opportunities, like allow the nurses to gather together and have some fun, have some celebration, celebrate some days, some kind of collaboration, some kind of exchange also can be done through the help of other hospitals which are nearby. So all that exchange programs or social connection opportunities can be offered to the employers or the heads who are managing or the manager level workers. Then mental well-being program, physical health, and financial wellness also has to be taken. Mental well-being programs are also a part of employer who has to take care. There should be a proper survey whether the nurse who is working in this hospital, okay, is that nurse managing well with the family or not, or is this work life is influencing something negatively upon the family life. That survey or that identification also can be done by the employer under mental well-being programs. So all in all, I would like to conclude with a take-home message that achieving work-life balance is essential for all of us. As a nurse working in the hospital, to maintain their well-being, allowing them to spend more quality time with their own family and with their own patients as well. So this is work-life balance, and mastering the work-life balance techniques are very fundamental to us now. And in coming days, this is going to be a booming field of work-life balance for nurses, because as the advancements and as the work pressure which is building upon, so it is a much more needed aspect of life, and very soon it may come into a nursing syllabus also, how to manage the work life. Okay, so this is my speculation, pure opinion, which I may assume like it may be a future of nursing, wherein which work-life balance will be the foremost thing. Thank you very much. And before closing my presentation, I would like to show on a brief video of 2 minutes.
Thank you. Nice to be here.
Can you hear the audio?
This piece I want
Yes,
to share
sir.
with you is
Yes.
actually not
Okay,
just a
okay.
trick or a puzzle to be solved, but rather a nice story that I want to share with you. It's a story that might teach you how to master the mystery of life. You see, just as many things in life, this old letter case is only a total of many different objects of unique size and shape, and only by a harmonic arrangement of these pieces they form a unique composition we may call life. And most importantly, everything fits perfectly within the framework of our lives. Now, you could name each of these pieces individually, maybe a solid base, a happy childhood perhaps, or a proper education, your own hopes and fears, your beliefs and memories, probably good friends and family in the center of the arrangement, and maybe even some decisions that you regret. But actually, it's not so important which meaning you give to these pieces. Much more interesting is this process. What happens if suddenly one of these pieces that defines us starts to tumble? Well, of course, we adapt. And sometimes we even have to make some basic changes. But if all these pieces work well together, then it is always possible to form a unit and once again to keep on. But life is never that easy, and destiny always has new challenges for us. But you could say that from time to time, destiny brings us something new that we have to arrange with. But how to include this new element into our perfect composition? I mean, every space is filled and it is already well stocked. So this whole unit slowly starts to crack under the pressure of the new experience. And sometimes it even all breaks down into pieces. Midlife crisis, quarter life crisis, or something in between. And we have to ask ourselves, how do we find that harmonic shape again? Well, with a little self-reflection and patience, with self-confidence and effort, it is possible to integrate any new piece into this arrangement and still form that wonderful shape that makes it so unique. But life is a series of challenges, more and more challenging, and it has always new things for us, sometimes even bigger and more unexpected than we are prepared to handle. But, you know, to conquer these challenges, all we have to do is sometimes
Hello.
Yes, sir.
Yeah, it's continued, huh?
change our
Yes,
point
sir.
of view
Continue.
Yes, yes, yes.
to
Half more
see
minutes.
things differently
Okay, sir.
in order to come up with a solution. And now perhaps you understand that it's not about the size or the position of these pieces, nor about the significance we place on them, but rather about this harmonic composition they form. And of course, most importantly, that everything fits perfectly within the framework of our life.
So thank you very much. I think I hope that video which was displayed could have helped you to understand how to adjust, adapt, and accommodate the life challenges which are way forward for all of us as a nurse, or we are encountering in everyday life situations. And everything has a solution. Anything, any challenge which is in front of us has a solution. We need to just have composure of our mindset, and we need to analyze and get clarity of those things, and we can achieve a balance in other way. Thank you very much. I hope I could justify the topic which was allotted to me. There is a lot of things to be discussed, but I attempted to overview these things. Thank you so much once again. Thank you. If there are any doubts, queries, you're welcome. Nikhil sir, I have completed the session now.
Okay, sir. Anyone having doubt?
Yes, anyone from the group who would like to ask any question to Bahubali sir? Sir has explained in detail everything, each and everything, but we as a nurse participant, yes, from the participant, anyone? No one?
No one having doubt? Okay. So
Can put
thank you
their
very much,
queries in
sir.
the chat box also. If they are hesitant to ask, orally, they can just type a question in their chat box as well,
Chat box.
so that
Yes.
we can discuss and we can sort it out. Because see, there are a lot of things to be told, but due to the constraint of time, I was not able to discuss those. If those are anything which are related to you personally, or if you have encountered anything, you can put in the chat box, and you are welcome to ask a doubt, so that we can shed some light upon those things.
I think, sir, no one is having a doubt. Sir has explained everything in detail. Each and everything in detail, sir has explained it. Very nice session, sir. Because all the things, whatever he has explained, is day to day, every nurses are facing with all those problems. And the one thing is, coping mechanism is also one of the most important thing they have for family as well as work. Very important. Yes, Nikhil, sir, you can go ahead.
Yes, madam.
Make sure.
Yes. Thank you, sir, for your wonderful session. And last video is giving a very important point to us to how to balance your life. And everywhere we see the problems come with a solution. So it is a very important and very wonderful session, sir. I hope after the session, all participants will surely focus on work-life balance as a first priority of health. So thank you very much, sir. Thank you. Now we move to next session. The next session is our case presentation by Sister Priyanka Kamble. She is working as a staff nurse in Dinanath Mangeshkar Hospital, Pune, since 1 year. She is going to present case presentation. It's humble request to all participants to involve during the case presentation. Thank you. Priyanka sister,
Yes,
handed to over, sir.
yes.
Yes, thank you.
So, good afternoon, everyone. Myself, Priyanka Kambre, a clinical staff nurse working in the Dinanath Mangeshkar Hospital since 1 year. So, firstly, I would like to thank Team ECO and Bharati Vidyapit for giving me such a wonderful opportunity to share my experience with you all. So, we'll start with the topic. The participants who are listed in the session, I hope they will interact with me and we'll have a two-way communication. So, what do you think? What all things are happening with us in the hospital in our day-to-day life as a nurse? So, I want the participants to answer what problems they are facing in the hospital while working patient side. You can message me.
Yes, madam, you can continue.
Okay. So, we'll start with the topic.
There is a one message.
Yeah, frustrated by daily routine. Okay,
Yes.
yes. And
Overload of
anyone
work.
else? Overload. Okay. Anyone else? Fear, anxiety, depression. Yeah, related to work. Okay. Time management. Yes. Salary tension. Overburden. Yes, yes, yes. These are all the problems we actually face in our work life. Okay. Heavy workload. Stress.
Yes, any problem? Nikhil sir?
Hello,
Nikhil sir?
Priyanka
Yes.
sister. Any problem
Sir,
from your side?
sir, please kindly make me the host.
Okay. Albino sir,
Yes, yes.
please.
Yes, Priyanka, you can.
Yes, sir.
Yes, Priyanka sister, you can continue.
Yes, ma'am.
Okay, yes, starting this.
Yes. So our topic is depression. So participants, I would like to ask you, what do you mean by depression? So there is a case of Mrs. X. She is 21-year-old woman working in Ruby Hall Hospital as a staff nurse since 6 years. She worked in general ward. She got married in 2019. She is having 2 kids, and gradually she is a hard worker. She was very punctual with her work. She was a hardworking woman. She was appreciated with her work by the in charges and team members. She used to provide curative care to the people. But after some months, she was very frustrated to her daily routine and work. She was not working well. She also used to get angry on her family members, always used to think of her work and hospital, that how she will make her work more happier than earlier. She was also developed with insomnia, aggressive behavior, and became self isolated. So, these are the problems which we as a nurse face in the hospital while working at the patient side. So, this is a case which has happened. So, the introduction of depression is a group of conditions associated with the elevation on lowering of a person's mood, such as depression or bipolar disorder. It means when the person is depressed, the depression goes on elevating. Elevating means increasing. If she is facing some problem in the hospital while working at the patient side, uh, she will get the problem more and more, and for her it is unable to control that problem or to solve that problem very quickly. She will take time for that problem to solve it. Okay, then we'll see the definition of depression. Common mental disorder that present with depressed mood, loss of interest or pleasure, feelings of guilt or low self-worth, disturb sleep or appetite, low energy and poor concentration. It means the person is depressed, her mood is not good, the interest of for working is lost by her, the feeling of guilt is inside her, that she will feel very guilty if she did something wrong with the patient, or while giving the care she did any mistakes. A self work disturbed, she will get disturbed while doing the other works too. If she had disturbed doing the work with one patient, the same will continue with the other patient, because of which she won't be able to sleep well, and she won't eat a sufficient amount of food, feel low, she would feel less confident, and her concentration while working might be poor. Okay. So causes, we will, what causes do you think because of what it happens?
Yes, from the participant, anyone, please kindly respond. There may be various causes,
Okay, like
maybe personal causes or social causes. as we see personal, we have a lot of problem we are facing because of that. The person, the nurse, the staff nurse, she may be having problem in working because of all this tension. And another thing is the of professional tension. So this may be there may be various reasons. It depends upon person to person and their coping mechanism.
Yes. So there are few causes. Like first one is high stress situation. High stress situation comes, we can say, in our profession every day. If the person is under serious condition suddenly, then we have to make a very quick decision. And while making the quick decision, there is a it could affect the difference between the life and death of a patient, which could make that nurse to go in a high stress situation. The other one, new nursing job, the nurses who are new to this profession, working as a freshers, they could experience this stress while doing work, anxiety handling patient. While handling patient, the new nurses feel anxiety. They are low confident while handling the patient, so it might increase the stress level. Okay. And then insufficient peer or mentor support. Whoever the higher authority we are working with, our colleagues, our senior, they might not support us as we needed, as our requirement. Okay. So all this situation can get us into a high stress situation. The second one, fear of causing patient harm. While doing patient care, if the patient is a surgical patient, and if there is any mistake while uh, giving care to the patient might get harm. And getting harm to the patient, it will directly affect the nurse's role, which is not good. And the nurses, okay, the nurses will get into stress, they will get fear. Okay. No matter whether it is a senior staff or a junior staff, everyone is hunted by the fear of medical errors should not get affected. Okay. Then many nurses who are unable to leave that stress, like if we had any situation in the hospital, that situation we take that in our mind and go home. And after going home, when we are at home, still we are thinking about that situation, what had happened, what we had done the mistake with the patient, and it will directly affect our stress level, which will lead us to get depressed. Okay. Then it might be anything. It might be while giving over to the other staff, next shift staff, we will face that if we forget to give some important message to that other shift staff, then we will have that thing in our mind that I have not done the right thing, and which I will think that tomorrow I will get that scolding from my senior or the head nurse or someone else that I have not done my work properly. So that thing which we think over and over and over, it affects our mental and physical. Okay. So it will lead to a high stress situation, which might cause depression to the staff. And the third thing is find work life balance. Work life balance, now only we attended the session of Mr. Bahubali sir. He had explained it very nicely. So I hope everyone understood what he had explained. We all okay. Then there should be a clear vision what we are doing with our work, what patient we are handling, what diagnosis he has. If all these things are clear now, then we will balance our work balance. It means automatically we'll balance our personal life too. Okay. So difficulty to clear division between work and home, which can cause anxiety and depression in nurses. So you should make a very clear vision between your work life and a personal life. Like some nurses are married, so they have to handle their married life also, their children's and their schoolings and everything, and the work also. So for them there is time management difference come, and some of them are unable to cope with the time management. Okay, so time management is equally important in work-life balance. If you do something, if you keep the work pending, it might be a professional work or a personal life work, it will imbalance both the thing. It will affect your work life too. So try to cope up with your problems, try to solve your problems with calmness, okay, with work in hospital. When you're in your professional life, just concentrate on that. Don't get all your home things or personal things into it. Just ignore that and work when you're in your profession. Okay. The last one is toxic workplace culture. Toxic workplace culture means lateral violence among nurses regarding major issues, feeling of failure or inadequacy in new nurses, no support. Mostly, this toxic workplace culture is experienced by the new nurses. New nurses means who are joined newly in the hospital, working newly at the patient side. They don't know the policies, how to work, how to attend the patient, what all medications, what are protocols. They don't know anything. So at that time, they struggle for it. So that time, they need a strong support from their co-worker or from the senior or from the higher authority, whichever, whoever there is. So at that time, we need to support them. But recently, what had happened with us is the senior staff is, continuously provoking that junior staff for do this, do that, do this, do that. But she was not explaining her what to do, how to do. And because of being senior, the junior staff was unable to ask her the question how, because she was afraid of that. This kind of situation comes. So you should keep that ability with you to ask the question how to do if you are not knowing something that staff, I don't know this thing, will you please explain me? So this is the way you should talk with them and make away your fear, your anxiety level away from you. Okay, this is how you will cope up with your work and the situation will get calmed down. Okay, and then we have sign and symptoms. Sign and symptoms because of heavy workload, because of the triggering in us, like we have to get up in the morning, I have morning shift, I have to go, and all these things in our mind are running throughout the day. So at night when we sleep, we feel like tomorrow I have to get up, and our sleep is incomplete. So we have insomnia, irritable behavior, like everyone, we have to rush for the patient. There is not only one patient, there are many patients where one staff has to run behind it. So the staff, her behavior gets irritable. So she herself get irritated, and she also that irritation comes out with their colleagues or family members or the children's everywhere. Then we have aggressiveness. Aggressiveness, there is aggression related to workload. When there is a workload in a day, when she is in the morning shift, mostly in the morning shift, we have a workload because all the doctors' rounds and everything we have, and there are updates in the morning. After every 15 minutes, 30 minutes, doctor will update something about the patient, and there is no one patient. There are many patients. So we have to look after all the patients. So there is aggressiveness, how to do this thing at a time in my morning shift, within my 8 hour shift, how will I cope up with this situation? So there is a aggressiveness. Then we have negative behavior towards family and colleagues. So because of this aggression, irritability, insomnia, we have a negative behavior in our home. Okay, now I am not talking about our professional life, I'm talking about our personal life. So in personal life, we behave with our family like whatever our family will say us, we will immediately answer them aggressively or in a negative way. Please don't ask me anything or whatever it might be. So it is the aggression because of which you are irritated, you are aggressive, your behavior is negative. Less communication. The depressed patient, they don't communicate more. Okay, the depression is so much inside us that we don't communicate. We want No one should talk with us, and we will also not talk with anyone more. Only the things which are related to work, we'll talk with that only. Okay. Then the next one, we have low concentration and confidence. When we work with patients at patient side in the hospitals, it should be like we have to concentrate on work. Whatever medicines has to be given to a particular patient has to be given to the particular patient only. Okay, so you cannot misbalance your concentration. It will adversely affect your profession, your professional life. Okay, you should be confident what you are doing with. Okay, then because of you can say the aggressiveness, there is a low concentration level, because you get low confidence because of if might you have done something wrong, like a wrong documentation. If you have done something wrong documentation, you might get that, oh my god, I have done something wrong. It means the next time, the next within few minutes, you will get low confident that what will happen if I'm doing it right or wrong. The next day you will feel, yesterday I made the mistake, what if I do it today also? So your confidence level get lower. Okay, then the next symptom is difficulty in handling work. Okay, when you have the patient from ER, emergency ward, the patient is shifted to your ward, general ward. Okay, at that time, and the time of your duty schedule is coming closer to go home. Okay, at that time you feel, okay, now I have to go home, and how I will handle the patient, and the patient is coming from you. So you have to handle the patient whatever the time is. No matter that you are going home, your shift is getting ended. Okay, you have to handle the patient. If you have more patient and one staff, at that time also you become stressful, that how I will handle 8 9 patient at a time in my shift. I have very less time. Okay, all these situations come, and because of all this situation, we get depressed, we get low confident, low concentration, we get aggressive. Okay, then the next symptom is feel guilty. If we had done something wrong, being a senior, if we had done something wrong, we feel guilt. Like, so many years I have worked here, I have worked with a patient, and still how can I do wrong? This is the guilt in we. Sometimes it happens. Not it is not like that ki if you're a senior, then you won't do any mistake. Mistake can happen anytime with anyone. Okay, but they have that guilt. So that guilt might affect them to get depressed. Okay. Then the next symptom is eating and sleeping pattern disturb. Okay. Then because of all these situations, what we have seen, because of less sleep, irritability, aggressiveness, the negative behavior, difficulty handling work, low concentration, low confidence, these all things will affect our eating, our physical health. Okay. Sleeping pattern disturb. Because of all this situation, we are taking in our mind, we are taking personally, we are not leaving that in the hospital doorstep. All these things will affect us severely, which will lead us to go into depression. Okay, so while eating also, you will feel that you won't your wish is not to eat. No, I don't want it now. All these things will happen. Okay, all these things will happen with you. Clear with sign in symptoms? Okay. Now we'll go for risk factors. Because of all these situations, because of because of low confidence, because of low concentration, irritability, family life problems, personal problems, everything, because of which it affects our work and the profession we are in. There should not be any mistake by us. There should not be any mistake done by us. We have to be very accurate while working at patient side. Okay. So the first thing is the risk factor is medication error. Medication error is which we cannot handle. We should not do medication error. It can harm a patient's life, and which is very dangerous, which is not good. So while giving medication, we should see to it whether the patient is the correct patient, the name of the patient. Okay, the bed number, we usually see the bed number of the patient, we see the name of the patient, diagnosis of the patient. Okay, we'll see whether the doctor has prescribed the medicine, whichever medicine is prescribed, whichever dose is given, frequency, route, everything we have to see it carefully, and then we have to give it to the patient. So medication error might happen when a nurse might be suffering from a depression, low confidence, irritability, so there should be a calm environment while working. So make sure when you work, you don't make that your problem to affect your work. Make that aside and just concentrate on your work. Try to get calm, relax. Okay. And then the second risk factor is patient harm. Just like I said, if we'll do any medication error, directly it will harm the patient. Okay, it will harm the patient. It will harm the patient's life. Okay. The next thing, risk factor is trust factor issue. Okay, if we do any mistake in our work while handling patient or anything at the patient side, whatever we do, whichever mistake we do, the next time our senior or our higher authority, they might have the trust issues with us that yesterday or day before yesterday or the last month she had done a medication error or she had done a documentation error, whatever the error is. The next time they will not trust us with the same thing, even though we are senior, but we had made a mistakes. Okay, so they will not trust us with the same thing. They will make sure that we are concentrated, we are confident, and what we are doing right. Okay, that trust factor also affects, even though if I had done any mistake, the next time I will also feel that yesterday I made a mistake, so today if I'm right or wrong, I will cross check myself. Okay, so every time whenever you work at patient time while medication or anything while giving patient care, cross check it. Cross check by yourself, cross check with your senior. Okay, cross check with your shift in charges, anything, but do right. Don't do any mistake. The mistakes will lead you to depression. It will make you to harm yourself by by doing negative things, negative communication. It will harm your behavior, it will harm you personally. Okay, so next we'll see the management. So participants, will you please interact with me about management? What management can we do? You can message me. Just think you are in that situation and you have to manage the things. So how will you manage it? How will you manage your depression? How will you manage your low concentration, your low confidence?
Very simple questions. Madam is asking all the participants, kindly please give some response. If the presenters keep on giving the presenting, and if the participants are not listening, there is no values for this presentation also. I have all the participants to give some response.
What all things you will manage with yourself when you are in that situation?
Anyone? Yes, management is one of the most important part for every point or for every
Yeah, always take care before doing any work.
whatever we are discussing. Yes. management. It can be management can be divided into two, that is medical management and nursing management. So what is the role of a nurse? What we are supposed to do, or what is our responsibility if having any problem?
Yes.
The one will have that another thing is with all the therapies. What we can do at home is will help us to reduce all those stress, anxiety.
Okay, we'll see to the management, what management should be done. So, first of all, to understand our own mental status, we have to understand our own mental status, whether we are frustrated, we are irritated, okay, and we have to handle that situation by our own. No one will come and tell us that you are frustrated, you are irritated, please do something and all. No, we are adults, we our own self should understand that yes, I am in a work, I am in a profession now, right now I am in a hospital, I am working for patient, so I have to be calm and relaxed, okay. Then the second thing, support from seniors and colleagues. If ever you are not able to handle any situation which is there, if you are not able to handle the situation, please take support of your seniors or your colleagues, okay. Don't hesitate to ask them what to do and how to do. They will surely help you, but please don't do any mistakes while giving patient care, okay. Then the third management is self promoting. Okay, self promoting means promote yourself for doing a positive works. Don't think negative. If I did this, then this will happen. If I did this, then something wrong will only happen. Please don't think all these things. Promote yourself by positive attitude. Positive attitude should be always there with you, okay. Then the next thing, relaxation practices. Yeah, it is very important for a nurse because we are handling so many patients. Our duty hours is long lasting duty hours, scheduled shifts we have, morning, evening, night, because of which we get frustrated. Obviously, it's a human tendency. When we get a heavy workload, we get frustrated, okay. So at that time, don't argue with someone or don't talk negative things, okay. Just make yourself relax, do meditations, yes, do meditations, do yoga, make yourself relax, think of positive things, listen. Some people, they feel, relaxed when they listen to music, when they listen, when they read books, so do the things which in which you are comfortable with, in which you feel relaxed, okay. It will help you to do the further work at patient side, okay. Do deep breathing exercises. Deep breathing exercises helps ourselves to get a very, very, very calm and concentrated with confidence, okay. Meditation, we have to do it. It will help us to concentrate at our work. And counseling, if ever you feel that I am not able to handle the situation, or I am unable to do the things, I don't want to work, I want to leave, and all these things come in our mind. That is obvious. When we are frustrated, when we are overloaded with the work, we all think about all these things, okay. Then counsel yourself, okay. Counsel yourself with that this is my profession, this is my work, and I have to do it, whatever it might be the situation, okay. Then what we conclude from this, depression, there are two things. It is a long lasting thing and a short thing. Long lasting means when the person is for 3-4 months is depressed, that is a condition that the person is a depressed. But in our profession, when we are depressed, like it is just for few days. Today in this shift, I have not done my work properly, I was low in my work, I will get depressed. But the next day, it might not be the same day, like it might not be the same situation, the situation might be different. The next day it might be better than yesterday. Okay. So always see to it that these two things are different. Don't make yourself the depressed person. Okay. Then the conclusion, what we concluded that make your professional life and your personal life balanced, manage your time. Okay. It is very important when you manage your time, then only you will handle both the things properly. Okay. I hope everyone understood. Thank you.
Thank you. Thank you, Sister Priyanka.
I think some people have put on some answers on the chat box. Not visible. Yes, Nikhil sir, you can continue.
Yes, madam. So today we have completed the session. I would like to thank ECO team as well as the mental health psychiatric department of 3 colleges, Bharati Vidyapeeth deemed to be University College of Nursing, Pune, Sangli and Navi Mumbai. Thank you to all participants. Thank you all of you. We will be sending a feedback link. Kindly fill the link. Albino sir.
Yes, sir.
Sir, feedback link is sent.
Yeah. It's
Yes.
there in the chat box.
Okay, sir.
I request participants to kindly look into your WhatsApp group as well. So last time also we had received little less than the first session. I request everyone those who are present today, please fill the feedback forms. Thank you.
So it is a request all of you. Please kindly fill the link.
Arvind sir, next Friday, I think it's a holiday for all, so our session is on 28th. Scheduled, yes, Nikhil sir, the schedule is on 28th. Because 29 is a holiday Friday. I think we have put a schedule on 20.